Which of the following interventions is most appropriate for this patient? Okay. 55-year-old man presents to his PCP with generalized bone pain, muscle weakness, history of CKD, currently on hemodialysis. Lab test reveals hypocalcemia, hypophosphatemia, elevated parathyroid hormone. Okay. Diagnosis of osteomalacia is made. Which of the following interventions is most appropriate? So he's having, okay, it's because he has CKD. Hmm. I know for like if it's I think of osteomalacia as like the adult version of rickets.
Okay,
Um,
good.
and for that I'm thinking like, oh, calcium and vitamin D, but I don't know if that's the actual treatment, um, as opposed to like intervention. I don't know if that would actually get anyone better. Um, Bisphosphonates you're gonna give for like osteoporosis. Um, In osteoporosis, your labs are usually normal. Um, Denosumab might be one of those, like might increase like IL-1, IL-6 or something like that. I know there's a weird one with that.
Okay.
That's bone related. Teriparatide, I'm not sure what that is. Unless that's like the prescription vitamin D. I'm not sure what that is. So I would go with calcium and vitamin D supplementation as the first intervention. But no, yeah, okay, that's right.
Yeah, I
Okay.
would say start here first, right?
Okay.
Because this patient has chronic kidney disease, and so
Hmm.
not absorbing calcium super well, so a deficiency in calcium, and so they have a secondary hyperparathyroid, meaning that because of their chronic kidney disease and they're peeing out a bunch of calcium, the body's reacting by releasing parathyroid hormone to break down the calcium in the bone to be able to, try to reach homeostasis, right? So the best thing
Right.
you can do to help at least is to supplement yourself, right? Of course, will this fix everything? Probably not, right? But at least you can start with this, right? And then if you're trying the best, right, as much as you can to stop the osteomalacia, right, then you can start thinking about okay, maybe bisphosphonate if the bone density is getting way too low, right? You can try these other medications that are a little bit stronger, like you said, monoclonal antibody that inhibits osteoclast to prevent the breakdown.
Yeah, I think that's like an IL-6, maybe, I want to say, if I were to
I
guess.
cannot remember exactly. And
Okay.
then teriparatide is actually a parathyroid analog used to treat
Oh, okay.
osteoporosis
I didn't
by
know that.
stimulating bone growth factor here, but not
Okay.
first line, right? And parathyroidectomy, sometimes, right? If it's so bad, right? Then you might have to take them out, right? To try to, obviously, if you take the glands out, you're not making any more parathyroid hormone, right? So yeah, I
Okay.
mean, these are all things that you can consider, but just not first line, right? I mean, the easiest thing to do is give them supplementation, right? And if it fixes
Hmm.
them, then great, you're good. If it doesn't, which a lot of times it doesn't, right? Then you have to think, okay, what medication do I want to use next?
Okay.